Mrs. Jones. It's Susan, your student nurse. I'm going to be doing your trach suctioning this afternoon. I came in earlier, remember, and I gave you your pills, so half an hour ago. I hope you're feeling a little better with your pain. I'm going to put the side rail down so I can get a little closer to you. All right, my supplies are ready. I'm going to put a towel around your on your chest so that there's no, you don't get wet. We don't want you getting wet.
Yeah, let's go over irritating and
Okay. You feeling okay right now? Okay, so I'm going to turn on my oxygen, my suction. Put my gloves on.
Either 8 or 8:30.
alright, I'll be here at 9. Because 8 is hot, man. Unless if I get to bed early tonight, I'll be alright.
Okay, so I'm just going to check the oxygen tubing and make sure it's suctioning properly.
My alarm went off, I said. See, I wish I would. Yeah.
All right, so that's working perfectly. Okay, so now I'm just going to get my supplies out, get my sterile field set up. And we're going to throw these away. Okay.
No, it was
Okay.
nurses at work, so I just left it in the mailbox.
I'm going to open up my package. This now becomes my sterile
That's what I
field.
told her. I'm like, I'm giving it back to you. She goes, why?
I'm going to open up my
With the engraving, I think it was like, it's not horrible.
pour the saline in.
Yeah, it's definitely a good Christmas gift.
I'm going to put my mask on.
Getting rid of that makes it so I don't need a name badge because you can't get rid of the engraving. She's going to go through irrigating.
And I'm going to put my sterile gloves on.
I just like the thickness of the tongue. It's huge. Compare this.
I like that giving a back massage of
Remember that was in CNA
Okay.
class too.
So now I'm going to take out the catheter.
How to make it back real good already.
And I'm going to come over here. I'm going to wrap this around my dominant hand for the suctioning purposes. And I'm going to hook this up to so now my non-dominant hand is no longer sterile. I'm going to check suctioning.
So the teacher wants to make sure they're doing it right.
Okay, that looks good.
For us, they kind of leave it up to, it helps them.
So over here,
That's why like it leaves it up. We're much more on our own. But they have their own workflow.
I'm a little twisted up here, but we're going to get this figured out. Except I can't. Never mind. Okay, so my suctioning is working perfectly. So I'm going to come over here. I'm going to take your oxygen off. I'm going to hyperventilate with 3 breath sounds. 1, 2, 3. Okay. And now I'm going to come in here. I'm going to insert this into your trach. Okay, and I'm going to twist it a little bit with intermittent suctioning for no more than 10 to 15 seconds. Pull that out.
Yeah, making sure they're the blue thing.
Are you feeling okay? All right. So, 1, 2, 3. So I'm going to let you sit for 30 seconds or so, and we're going to do this again. Okay, so after 30 seconds, we're going to suction again. And insert this down, twisting with intermittent suctioning, no more than 10 to 15 seconds, pulling out. At this point, point, I'm not going to hyperventilate again. I'm going to put her oxygen back on. I do not feel that she needs any more suctioning. I'm going to come over.
This is the one where it's sterile, right?
Once again, I'm going to lubricate my catheter. I'm going to come over to the patient, and I'm going to do oral care and get her mouth suctioned out. I'm going to run it along the gums of the lower teeth and the cheek on one side. And if I can do the other side, I'll do the same. And get her mouth cleaned out. And I make sure she's comfortable. Her sats are coming up. And she is breathing okay. So I'm going to take my mask off because I can't see. So, Mrs. Jones doesn't mind. So, with this, I'm going to take my catheter and wrap it around my dominant hand, and I'm going to take the suction off. I'm going to pull the glove off over the catheter. I'm going to put that glove into my non-dominant hand, and I'm going to pull this glove off over those gloves. And then this is a nice, neat little package to throw away. Come over here and throw this out. And I'm going to perform hand hygiene. I'm actually going to, now, I'm going to pull her gown down, or her towel off. Careful not to touch the inside, just the outside. We're going to throw that away. I'm going to raise her bed rail back up and make sure she's comfortable and safe. And I'm going to listen to her breath sounds.
Just wash your hands. It gives you a minute to think about what you're
need to
supposed to do. Yeah.
Come over and turn off my oxygen, my suctioning as well. I don't need that on any longer. Okay.
Ever ask you a question, just say, I need to go wash my hands.
I need to go wash my hands, and then you can think about it. Yeah.
This patient is 30 to 45, face power, difficult to get tissue, put on gloves, discontinue suction.
Everything sounds good. She's feeling that she's breathing a little bit easier, and make sure that oxygen stays in place. And her sats are perfectly where they need to be for her, and she is all set. I'm going to put the bed back down,
As you're removing it, why do you need to check plastic?
leaving her head up just a little bit for comfort. I'm going to remove the bag and get her all tucked back into bed. Her call light's next to her,
Or clear with 30 to
and I will be back to check on you shortly. Call if you need anything.
You don't do residual.